Welcome to the Deep Dive. We cut through the noise to get you well-informed, fast. Today, we're looking at something we all rely on, primary healthcare. But here's a twist, maybe something you haven't thought about. The system that keeps us healthy. It actually has a pretty big climate footprint. We're basing this on a recent systematic review, Walsh and colleagues, 2024.
That's right. And our mission today is really to explore that footprint. What is primary care's environmental cost? And more importantly, what can we actually do about it? We'll see how your local clinic visit connects to, well, global health.
Okay, so let's dig into the scale first. Globally, healthcare overall, we're talking maybe 4 or 5% of greenhouse gas emissions.
Yeah, which is already quite substantial when you think about it.
Definitely. But primary care specifically, it's not small change. The review points out for the NHS in the UK, it could be like 20 to 25% of their whole carbon footprint.
Exactly. That's a huge chunk, just from GP visits, dental checkups, that sort of thing.
So where's all that coming from? What are the main culprits here?
Right. So the review highlights these carbon hotspots, and they fall into two buckets, really, clinical stuff and non-clinical stuff. On the clinical side, you've got pharmaceuticals. They're a big one, especially inhalers.
Inhalers, like for asthma.
Yeah, exactly. And the difference between types is frankly staggering. A standard metered dose inhaler, the puffer kind, that could be around 28 kilograms of CO2 equivalent.
Wow. Yeah.
On a dry powder inhaler, maybe just 1 kilogram.
That's a massive difference for basically the same function.
It really is. It means, an average GP consultation might start at maybe 4.4 kilos of CO2 equivalent, but add in certain prescriptions, and it can jump to like 66 kilos.
Just like that.
Just like that. And you also have anesthetic gases, particularly in dentistry. They add up too.
Okay, so that's the clinical side. What about non-clinical?
Well, think about how everyone gets to the clinic. Patient travel, staff travel, that's a big one.
Right, cars, buses.
Yep. Then there's the energy to run the building itself. Heating, lighting, equipment, and the whole supply chain, getting all the medical supplies, equipment, even office supplies to the clinic. It all has a footprint.
It really paints a picture. So if the impact is this clear, this measurable, why isn't it being tackled more aggressively? Why isn't this common knowledge?
That's sort of the million-dollar question, isn't it? And the review really digs into the barriers. A major one is simply a knowledge gap. Many healthcare professionals, well, they haven't been trained to think about the carbon cost of their decisions. Sustainability just hasn't been a core part of medical education or practice traditionally.
So it's hard to fix something if you don't fully see it or understand it.
Precisely. And then there's a really complex ethical dimension.
How so?
There's this perceived conflict, right, between doing absolutely everything possible for the patient right in front of you and the environmental impact of those choices.
Like you don't want to compromise care for the sake of emissions.
Exactly. It puts practitioners in a tough spot. This links into something called over-medicalization.
Okay, what's that?
It's basically providing treatments or tests that offer very little actual benefit to the patient, but still generate waste and emissions. Think maybe prescribing antibiotics when they aren't strictly needed, or excessive diagnostic tests.
Yeah.
The review mentions asthma inhalers, again here specifically, the overuse of the reliever inhalers, the SABAs. That alone can apparently increase a patient's carbon footprint by like 8 times.
8 times just from overusing the reliever inhaler. That's
Yeah.
quite something. So doctors are caught in this bind. Patient first, always, but also the planet.
It's a real tightrope walk.
So knowing these challenges, what does the path forward look like? How do we actually start reducing this footprint? What are the solutions?
Right. The good news is the review outlines quite a few strategies. On the clinical side, a big focus is on medicines optimization.
Which means?
Basically, being smarter about prescriptions, deprescribing things that aren't adding much value, switching to lower carbon alternatives when it's safe and effective, like those dry powder inhalers we talked about.
Okay, that makes sense.
And promoting preventative care is huge. Keep people healthier. They need fewer interventions overall. Telehealth, virtual appointments. That can also cut down emissions significantly, mainly from reduced travel.
Reducing all those car journeys.
Exactly. Then there's education and policy. Sustainability needs to be embedded right into how doctors, nurses, pharmacists are trained.
So it becomes second nature.
Hopefully. And getting patients involved, too. This idea of green-informed consent, maybe having a conversation about the environmental impact as part of discussing treatment options.
Interesting. So patients become part of the solution.
Yeah. And we need ways to track progress. Frameworks like Sustainability Quality Improvement or SUSQI are starting to offer tools for practices to measure and manage their impact.
And the non-clinical stuff, the buildings, the travel.
Absolutely. Things like upgrading clinic buildings to be more energy efficient, improving insulation, switching to renewable energy sources, better waste management, reducing single-use items where possible, it all adds up.
So it really is a whole system approach needed here. Smarter clinical choices, better education, greener buildings, engaged patients. It touches everything.
It really does. It's not just one silver bullet. It requires change across the board.
Which brings us maybe to a final thought for everyone listening.
Yeah, I mean, this research prompts a really important question for all of us, doesn't it? As people who use healthcare, how can we become more, let's say, eco-literate patients? How can we actively participate in pushing for and being part of a healthcare system that's sustainable, one that genuinely prioritizes both our personal health and the health of the planet we all share?